Welcome, everyone. We're so excited to have you join us today during Nurses Week. This is an exciting time for nurses in general. It's been an amazing year to highlight all of the accomplishments of nursing and to show what nursing can do in general, as well as for the nursing in the hemophilia area, or I should say the inheritable bleeding disorders area. We're excited today to be able to highlight several of our excellent nurses that we have in our Nursing Excellence Fellowship. Today we have with us Kelly Tickle, an MSN from Children's Healthcare in Atlanta, Lydia Johnson, a BSN from Cardinal Glennon Children's Hospital in St. Louis, Missouri, and Brittany Savage, who is an advanced practice nurse, MSN from Indiana Hemophilia and Thrombosis Center. And they are going to share with you their journey of having been fellows for the National Hemophilia Foundation Nursing Excellence Fellowship. And I'm sorry I never introduced myself. I am Dr. Michelle Whitcup. I am the head of research at the National Hemophilia Foundation and proud to be able to present these nurses for you today. So with that, I'm going to turn this over to Kelly and have her tell us about her award and all of the outcomes from that. Kelly?
Thank you, Michelle. Go ahead, you can advance the slide. I think the first couple slides are some of NHF's slides.
You know what? I'm sorry, I forgot about that. I was thinking of going right into yours, but let me go through this. For the National Hemophilia Foundation, our mission is dedicated to finding cures for inheritable blood disorders and to addressing and preventing the complication of these disorders through research, education, and advocacy, thus enabling people and their families to thrive. So again, we are talking about the Excellence Award today, and specifically for NHF's Nursing Excellence Fellowship Award. This awards $15,000 a year to nurses who develop research and other topics or projects that are focused on expanding the knowledge and improving the delivery of care and quality of lives for individuals with inheritable bleeding disorders and their family members. So it is exciting today to be able to share with you the outcomes of two of those projects that we have had in the past. We're going to showcase the work of these recent Excellence Fellows. We're going to discuss the peer review process of the fellowship. So for those of you who might be interested in pursuing an Excellence Award, it'll give you an idea of what to expect in that application process, and will help you in creating a compelling application yourself. Our overall goal is that we would like to create a research culture within the Hemophilia Treatment Center system. We would really like to promote nursing research as well as social work and physical therapy research. There are similar awards in those disciplines also. And we want to provide you the resources that you need in order to create an excellent application. And we want to give you the tools to do that. So again, our presenters, Kelly Tickle and Lydia Johnson. And Kelly, now it's your turn.
Thanks, Michelle. Thank you, NHF, for having us today to talk about our projects. It's really a fun experience. So I'm Kelly Tickle. I'm a pediatric nurse practitioner at Children's Healthcare of Atlanta's Comprehensive Hemophilia Treatment Center. And my study was titled Quality of Life and Outcome Improvement in Adolescents with Bleeding Disorders Receiving Medical Management for Heavy Menstrual Bleeding. It's a mouthful. Go ahead, Michelle, you can advance. So this was the rationale behind the study. Heavy menstrual bleeding is very common in adolescent females who have an underlying bleeding disorder affecting 4 to 36%, though I think the number may actually be greater. Bleeding reduction strategies vary greatly. So the type of medications we utilize to treat heavy menses, the different just treatment modalities are very different from center to center. And heavy menstrual bleeding seems to greatly affect quality of life in this adolescent population. So I wanted to see exactly how it affects it. You can see the chart here. The black bars that you can see are women and girls that have heavy menstrual bleeding with a pictorial bleeding assessment chart level, go back, thanks, greater than 100. And you can see that it affects lots of areas of life, such as absenteeism from school, sports issues, travel issues, and as compared to their counterparts that do not have heavy menstrual bleeding. Go ahead. These are a lot of the areas of quality of life that are affected by heavy menstrual bleeding, including it can cause iron deficiency anemia, increased hospitalizations, limitations with daily activities. We talked about absenteeism from school and work, numerous psychosocial effects, including depression and anxiety, pain during periods, and reduced overall quality of life. Next slide. So the aims of the study were to evaluate a baseline quality of life due to untreated heavy menstrual bleeding in adolescent females with bleeding disorders. And then we wanted to look at different treatment modalities, including hormonal therapies and non-hormonal supplemental medications, such as antifibrinolytics, and see if they had any effect on overall quality of life. Next slide. This was the design of the study. It was a prospective study, including any women or adolescents ages 9 to 21 who had reached menarche and were diagnosed with a bleeding disorder, whether it be mild or severe. All ethnicities could be included. We provided data collection on electronic portable devices like a tablet, and we collected a set of validated electronic questionnaires every 6 months for 12 to 24 months. Next slide. This is a list of all the questionnaires that we utilized for the study. There were 7 of them. Some were just some basic demographic information, seeing when they reached menarche and their age and their diagnosis. Some of them helped to capture what medications we were using to treat their heavy menstrual bleeding. The patients could rate their own bleeding. They did a self-bleeding assessment chart and could rate their own bleeding symptoms. And then we had some that looked specifically at quality of life, a Promise 29 screen, that's a non-disease specific quality of life study survey, and then a fatigue survey. We also completed a pictorial bleeding assessment chart, and y'all saw that on that first graph that I showed, where it helps to quantify if someone meets the criteria for heavy menses. Next one. I started this project, I was awarded it in 2018 and got IRB approval through our institution. In January of 2019, we got approval for the REDCap project. REDCap is an electronic database you can use to capture data. In February of 2019, I received the funding from NHF. In March, all of our questionnaires got approved, and then we were able to get some CLIN cards through our nursing research department. So know that if you, get the fellowship and you have this opportunity, also places within your institution may want to support this study that you're doing. And so they did within our nursing research department and gave us some gift cards we could give to patients that were participants. And then in May of 2019, we created our REDCap database for data collection. I have the sloth over here because, it's a slow process anytime you do research. So you have to be very patient just as it goes through each of the steps. Next slide. So currently we have 50 of our 50 patients that we were trying to enrolled. We are completing the final patient follow-ups. I had mentioned that we were doing surveys every 6 months for 12 to 24 months. And so we've got about 10 patients left that we need follow-ups on. COVID-19 hit, everybody knows it's affected every institution around the country. And our study was no different. We had to change things up, get approvals to do some on, web conference with patients to do follow-ups or telephone encounters versus in the clinic. So that definitely slowed down the study a little bit. It was supposed to be completed in 2020. So we've got a little bit of an extension. Next slide. Just to give you a little information about it, this is the demographics of our 50 patients that we've enrolled. We've got a whole bunch of different bleeding disorders characterized within the study. some hemophilia patients, von Willebrand's disease, some other factor deficiencies, platelet dysfunctions, Glanzmann's. Through the patients, 88% of them have reported flooding with their menstrual cycles, 62% have reported large clots. And the graph there shows you the average age of menarche for our participants, which was 11.4 years, which is pretty consistent with the national age of menarche. Next slide. This is that self-bleeding assessment chart. I wanted to pull just a couple questions, kind of give you guys a taste of what the patients are seeing on their surveys. So this was one of the questions. Have you ever had heavy menstrual bleeding? 96% of the patients enrolled said yes, 4% said no. Next slide. This is that pictorial bleeding assessment chart that helps to characterize patients with heavy menses. And you can see where their bleeding was at baseline and then at 12 months. So you can see on the bottom of the baseline graph, the chart goes from 0 to 4,000. And so that's the overall score within the bleeding assessment chart. Remember, any score over 100 is considered heavy menses. So you can see that the majority of those dots fall past the 100 barrier. And so most of the girls had heavy menses at baseline. And then if we look at 12 months after they started receiving treatment, and if you kind of drew an imaginary line where the 100 would be, you could see the majority of our girls now fall below the 100 without being considered to have heavy menses. Next slide. This is our Promise 29. This is one of the quality of life surveys. One of the questions is, I feel fatigued. And I wanted to capture the data for you guys at baseline and 12 months. So at baseline, it's hard to read. It might be bigger on y'all's screen, but the top line says not at all. And then every answer underneath there says like a little bit, somewhat, quite a bit, very much. So you can see at baseline, most of the patients reported the bottom 4 bars, which are, they did feel fatigued in some way. But looking at the 12 months, we have had an improvement in that statistic, with the majority now reporting that they do not feel fatigued at all. Next slide. Another question from Promise 29. I have trouble starting things because I'm too tired. Very similar answers. And again, you can see that the bottom 4 bars, and I'm sorry, I don't have a pointer, guys, but the bottom 4 bars on the left side, baseline data, the majority of patients did report that they had trouble starting things because they were tired. And then if you look at the 12-month chart, while we haven't captured all the patients yet through the follow-up, you can see that the majority now are reporting that they don't have that symptom at all. Next slide. This one is, I feel depressed. So we mentioned a lot of psychosocial issues within the quality of life factors that can be affected from heavy menses. This one, we haven't seen a significant change in. So I'll be really interested to see, once we do capture all the data, if we see any differences before and after related to the heavy menses and the feeling of depression. Next slide. So this, just the summary of my overall experience with the fellowship, has been fantastic. It was a learning process, and I know a lot of people out there probably, you're thinking about doing it, but you don't have a lot of experience with research. There's a lot of great mentorship through the program, through the guidance through your institution. So if you're even somewhat interested in it, I would say go for it, submit an application, and just see where it leads you. There's definitely a lot of learning through it, but it's a great experience and it opens a lot of other doors for you. So thank you for that. If anybody has any questions, there's my email address. Feel free to send me an email. I'd be happy to answer any questions.
Thank you, Kelly. And just as a reminder, if anyone has any questions, you can put them into the chat box or the Q&A box, and we'll address them at the end after everybody is finished. So next is Lydia Johnson. And again, Lydia is a BSN from the Cardinal Glennon Children's Hospital in St. Louis, Missouri. And she's going to be presenting her project. Lydia?
Good afternoon, everybody, or good morning, wherever it is that you might be sitting right now while you're watching this. So, as Michelle said, my name is Lydia Johnson, and I am the nurse coordinator for the Pediatric Hemophilia Treatment Center here at Cardinal Glennon. I'm here today to share with you some of the highlights and details of my clinical project that was supported by the Nursing Excellence Fellowship Award through NHF. It was titled, and is titled, From Stars to Beyond, the Education of EMS Providers to Improve Pre-Hospital Care of Individuals with Bleeding Disorders. Next slide. So I want to start, let me begin with what is STARS and what is this program about. So the STARS program is an acronym for the Special Needs Tracking and Awareness Response System. And we can just go ahead and click in all of those pieces, and I'll speak to them as I'm going along. So the STARS is the, like I said, the acronym for the program, which really describes the purpose and mission of this program. It was founded in 2014 here at Cardinal Glennon Children's Hospital, began as a community outreach program to assist in identifying high-risk children in a single response area, and at that time it began in the St. Louis City area. The patients were identified as children with chronic medical problems that fell outside of the paramedics' scope of practice, but for whom EMS personnel were being called to rescue. Cardinal Glennon staff recognized that the need to take a lead with the EMS providers for this program following several cases when medically fragile children arrived to the hospital, to our ED, without necessary care in their transport, leading to some poor outcomes with extended hospitalizations and initially, at that time, 2 deaths that were attributed to that. So while we recognize that there are many complex medically fragile children that are becoming more and more a reality in people's homes as they return to their families with all types of care that's being required, those children, when they get into issues of distress, EMS is called, but we recognize that it wasn't enough to just put something on an alert in their home that said, this child is medically fragile, but rather let's give those EMS providers some additional information about those children to see how they could best assist them so the child had a positive outcome. A team of EMS providers allied with our emergency department began to identify what training the EMS providers would require. The program, we can go back to the other slide still. It is in the state of Missouri, so the entire state of Missouri and southern Illinois. It includes ambulance districts, fire districts, air medical services, and community hospitals. And then there's a piece of that, obviously, a big part of that is the patient identification. Okay. Next slide. So EMS providers include personnel at multiple different levels. Something that I learned as I began this process was that there are multiple different levels of EMT and EMS providers, paramedics, et cetera, and so trying to address what education needs they required was a piece of this process. Once the STARS program began being recognized in the state of Missouri and southern Illinois, it was very early on, many patients were being referred to that program. How we began being involved in that program was in 2018. We were asked to speak to the EMS providers at a conference because we had a family in the state who was working on legislation in the state of Missouri to mandate that EMS providers infuse factor for any child or any patient who had hemophilia and had their factor with them. However, you can't just mandate that somebody do something like that because all EMS providers work underneath the direction of a medical director, and the medical director has to give them permission to do that. So there might be a law that says you have to do it, but unless they have a provider and medical director that allows that, they're not able to do that. So then we began working with that program and identifying the patients that we would be working with. I will say that in our program, all of our patients that we worked with in enrolling them in this study or in this program, in the STARS program, were all patients with hemophilia. Let's see. So I mentioned we have 2 states that we cover. We have 37 counties. The fire districts, each county has at least one fire district and most often an ambulance district that is involved with their programs. Additionally, what may be of interest is that several of the districts and the counties now have community liaison programs by which the EMS personnel will go into a patient's home and provide diabetes monitoring, blood pressure checks, well care checks. And so as part of that community liaison program, working in very much like a role of a visiting nurse, these EMS providers can provide care in a person's home, separate from just an emergency call to them. We have several of the advanced EMTs and paramedics who work within our emergency room department and work with outreach programs, and they are the ones that I worked with regard to this program. So I want to talk a little bit about the process of child identification. So when somebody's going to enroll in the program, we speak to them about the STARS program, and then if they're interested, they sign a form that giving permission for the people, the EMS providers in their county, in their district that they live in, to come to their home and do a home visit. When they do the home visit, they get to meet those people, and then they get some basic information about the patient, and then once they're still agreeable to work within the program, our HTC then receives a plan of care that we develop. That then is shared with the EMS director, medical director, and once they sign off on that, then any of the EMS providers within that district are allowed to provide the care. So we basically are teaching them and giving them permission to give the factor and treat a bleed. All right, we can go to the next one. Next slide. So I want to talk a little bit about just how we did our teaching. So we did in-person group classes. When we first began this process in 2018, prior to this grant being awarded, we taught 1 or 2 classes and early on recognized the need to share this information with a greater number of people. There was also an interest by the EMS groups to be involved with this and get to know more of these families. And so we began conducting in-person group classes. Our class sizes ranged anywhere from 2 to 20. The EMS providers work on a 24-hour basis. So they are on a 24-hour shift, and so we would offer multiple classes throughout a day, oftentimes multiple classes within a week or over a month to be able to get the majority of those providers within that district educated. Each of the classes was approximately 30 to 60 minutes in length. I gave them the basics about hemophilia, what types of bleeds to look for, the treatment options that they would have available to them, including obviously the use of rice, and then of course how to give factor. We did hands-on demonstration with regard to the mixing, preparing, and giving factor. And most of them, obviously as EMS providers, everybody that I was teaching have a lot of experience with giving IV medications. And so that was not as big of a piece of teaching as just teaching them how to mix and give. Most of the EMS providers that I worked with said that this was like, okay, so it's like Solumedrol. Well, yes, adding a liquid to a powder and getting your product, yes, that is very much similar to that. So they felt much more at ease once they were able to practice with some of those pieces. The evaluations that we conducted were, so everybody had a sign-in process, and then we had them complete an evaluation form at the end of the class, which is how they ended up. They all require CMEs or continuing education to be able to keep their licensure regarding whatever level of EMS provider they are. And so they're completing their evaluation allowed them to then obtain their credits for the education that they attended. Once they completed that evaluation, I should also just backtrack a moment and say that those in-person classes, we also included, for many of the classes that we had the family of the patient and or the patient attend any of the courses that they wanted to, so that the EMS providers could then actually get to meet the person that they were going to be able to, that they might be infusing at some point. And I think that made for a lot of relief on their part as well as on the families to be able to get to see some of the faces of the people that they might meet in the future under a duress type of situation. We quickly recognized that in order to meet the need of the number of people that we would need to be educating, we needed to develop a webinar and other types of methods to get this education out to a larger group of people rather than just myself going out individually to these locations. All of the education for the in-person group classes began about mid-year 2019. But then there was COVID, and that has affected, so there have been no classes that have been held in since February of 2020. So again, the folks who handle the STARS program have been very busy trying to identify how to do their education. So they do a lot of education with regard to trach care and seizures. I mean, there's a lot of other complex medical issues that they're also training their EMS personnel for. So I am on their list of people that we're working on the webinar, and that is currently underway. We're hoping to reach a much larger number. Right, I think we're ready for the next. This was just a picture of one of the classes that I did. It was one of the city locations. It was through their fire department, but they also have their EMS, their ambulance district is associated with that same site, and so we did classes over about 4 days at that. You can see in the picture some of the samples, so I was able to and continue to obtain some sample from some of the different manufacturing companies to provide the hands-on demonstration for being able to mix factor, telling every one of the people that participate that you may or may not be seeing a factor product that looks like what you're going to be practicing with, but the basics are liquid into the powder, create the liquid, pull the liquid out, and infuse it. So the next slide, I think we're ready for that. So we had, for the number of courses that we had, classes that we held over that 6-month period of time, we had 200 EMS personnel who attended. There were approximately 20 classes that were conducted in person. As I mentioned, each person signed an attendance record. We additionally held 2 conferences at rural community hospitals, and we had a total of 75 participants at those conferences. They too completed an evaluation. In terms of pre-hospital care events, so as you may recall, the title of this was to improve the care of the pre-hospital care of the patient, and in our situation, we had 10 children who were assessed, who had a call made to the EMS provider. There were 10 that were assessed. 8 of those received factor. And of the 2 that did not, by the time the EMS arrived on the site, there was no bleeding, no symptoms of bleeding identified, and the parent and the EMS providers decided that no factor would be required, and those 2 patients called the hematologist on call to just verify what their findings were and why they called the EMS to begin with. Of the 8 who received factor, 5 subsequently made a were transported to the hospital for further evaluation, both physical exam and radiologically, with no bleeding noted at the time that they arrived at the hospital, either by X-ray, CT scan, or by physical exam. So that was a positive. Once they were cleared by the emergency room provider, they were cleared to go home, and there were no significant poor outcomes with regard to any of this. So the evaluations completed by the participating EMS providers were positive with regard to class content and hands-on demonstration and questions answered. I will say that I myself learned quite a bit in terms of working with these people. I had no idea all the things that an EMS provider can do. And again, it depends upon what their training and what their level of registration and licensure is within that system. But when the first class that we ever held, one of the questions that I had from one of the participants was it okay if they gave the factor, if they couldn't find an IV, if they gave it IO? Now, I'm pretty sure that my mouth dropped pretty wide open when they said that, because I couldn't believe that but that is when they can't have IV access in the field, they have little drills that they carry with them, and they drill a little hole and they give the people their fluids that way. And so I had to go back to my provider to ask that question. We could not find anything in the literature that suggested that that would be okay. And within 2 weeks of that class being held, we had a patient who was transferred to us from a Southern Illinois hospital with bleeding from a circumcision and a head bleed, and they had tried multiple times to get IV access to him. He had practically nothing available to him. He arrived in our NICU. The neonatologist and the NICU nurses tried to access. They were unsuccessful, and the neonatologist, amazingly enough, because I didn't realize they had him in the NICU, had a little drill and provided factor IO, and the patient stopped bleeding. So our physicians then did a article and a presentation at ISTH with regard to that, because it was the first time that, to our knowledge, that it had ever been given IO. Now, again, obviously the manufacturers do not say that that is a way that you can give it. So when I do the classes and teach these EMS providers, I do not tell them that that is a permissible way to give it, but I also am not going to tell them that they can't do something that they may view as necessary. So I think we're ready for the next slide. So I think one of the things that for future recommendations with regard to this project, because obviously it is still in and underway with regard to the number of patients or the number of people that we're trying to reach out to, but we have created pre and post tests, because I'd really like to understand what they know better after what they've attended versus just, did you like the class? Did you like the presentation? Did you like the hands-on demonstration? I want to measure what they know with before and after we do the class, and then I would like to do that post-test again 6 months later. With community projects, programs, we were looking to reach out to other community hospitals, the local chapter. We have been working with our local NHF chapter with regard to the STARS program, but to increase the knowledge for those community programs. We are still identifying who we would reach out to, but we would offer this information with regard to the STARS program to those people, recognizing that what we're, trying to do is, again, look at improving people's lives and making a difference. The other piece that we're still working on too initially the objective of this study was also to look at whether or not it would be possible to pull and do a STARS program, not only here in Missouri and Southern Illinois, but would it be possible to take pieces of this and push this out to our region, our Great Plains region, and then perhaps NHF, so that other EMS providers in other states, recognizing that each state has their own rules and regulations as to how EMS providers can operate. But that is our goal, is to try to get this so that we can, again, improve that pre-hospital care of the patient. I think also recognizing with the increased number of patients that are being placed on Hemophilia, that the use of factor in people's homes and people's skills with being able to give factor, especially if they've never learned how to give factor with these little ones who start on Hemophilia very early, that having EMS providers and others who can provide that medication prior to them having to come to a hospital is going to be key. And that is all for me today. I thank you for your time, and I so thank the NHF for their support of my project.
Well, thank you, Lydia. That was excellent. Very much appreciated. Now, Brittany Savage is going to finish off with talking about the whole process to apply for the Nursing Excellence Award. And as a reminder, Brittany is an MSN from the Indiana Hemophilia and Thrombosis Center in Indianapolis, Indiana. So Brittany, you can go ahead and take it away.
Thank you, Michelle. So yeah, I am not a fellow, but I'm here as a representative from the Nurses Working Group, and we do review the letters of intent and applications. So that is why I have the opportunity to explain the process today, the process related to applying and really how those applications are reviewed. And I do have to say, there is a fantastic video that reviews the step-by-step process, and Karina, I think, was the one that did that. And it starts with the call for letters of intent, and then it goes up until, you know, the start date of the project. And there are really important details within that video that I may not necessarily review, because one of our major goals was for you all to hear from those that were awarded the fellowship. But I do plan to highlight some important points. That video will be linked at the end of the webinar, so do make sure to watch that. And there should also be some information on the nursing page through NHF as well. So Michelle had mentioned that as part of Nursing Excellence Fellowship, the awardee does receive $15,000 per award cycle. It is a 12-month project duration, but one may request a 6-month no-cost extension. As far as eligibility, the individual does need to be affiliated with a U.S. institution. Interestingly, you know, the MDT team and different centers can work together for these projects, so you can combine your awards. So multi-center projects are welcomed. And the area of focus really must be within the inherited bleeding disorders realm. So past areas of focus have included patient community education tools, health disparities, access to care, service utilization, clinical pathway development, and that's really just to name a few. You can visit the website to see areas of focus in the past if you have interest there. And while employment by a federally funded HTC is preferred, it's not required. However, endorsement is required. So mentors must have a direct link to a federally funded treatment center. You can progress to the next slide. So let's talk a little bit about letters of intent. The calls for letters of intent occur in the spring. But what is the point of this? And I think that's important to know as you're creating your letter of intent as well, because we don't want individuals to spend a lot of time on an application if the project really is not feasible, or if the applicant is not able to successfully complete the project. So like, what might an example be if the project's not feasible? So say there's no support of leadership or their mentor, or it really can't be carried out. You know, will they be mentored? And if they're not necessarily experienced, in the research area, are there other ways that they can be successful? And as Kelly mentioned, like, just apply, if you're not sure, reach out for help. And it's because it's a really great experience. So letters of intent are due July 5th of 2021 this year. Specific letter of intent requirements are online. So again, make sure that those are reviewed before developing that letter of intent. I just have to say that some of the requirements include details related to length and font, all the way up to, how you'll demonstrate feasibility. You'll include a CV or a bio sketch that will need to be included. So what happens then is the Nursing Excellence Fellowship has this subcommittee within the nurses working group, and we review those letters of intent. We have up to 3 individuals who do that. And invitations to apply are extended if eligible. That invitation to apply will be via email, and instructions will be included in that email. You will receive a link to electronic application with a guide to the application question. So you'll have this guide, you can have that pulled up, have everything ready, and then go online and fill it out. You can go on to the next slide. So applications, what is included? There are other aspects of the application other than including letters of recommendation and budget, but I did want to highlight these specifically for the sake of planning, honestly. But otherwise, the application, they ask for background information, demographics, again, the CV, an abstract. Again, I think this is probably the 3rd or 4th time I've said this, but it's important to refer to the website and that YouTube video at the end of the presentation to review all requirements. The application deadline is August 16th this year, and they will not be accepted after that date. I had already mentioned that applications will be submitted online. Just some things to note: you can copy and paste from Word, and you can also close and resume your application, but you have to be using the same computer. So those are some important things to note related to that. So after that application is submitted online, the nurses working group, the same committee that reviewed your letters of intent, they review the applications. And what happens is we each have a rubric. I will be reviewing that rubric with you all. We review the applications individually with the help of a rubric, and then we convene together and discuss and add those scores up to develop a total score in the end. Once we have determined in that manner who has the highest score, the winner's probably not the best word, but the fellowship awardee will receive notification that they received that award. And then those who did not receive the award that year will be provided feedback, and that'll be really important if you would like to try again to apply in another year, to receive that feedback so you know what you might be able to improve, application wise. You can move on to the next slide. So with the scoring rubric, I really wanted to highlight this as part of this webinar because I think, it's pretty common for all of us, if you're applying for something, to make sure you're dotting all of your I's and crossing all of your T's and making sure that everything's turned in. But it's really nice to know on the other end what people will be reviewing, right? And that will help you with developing your application. So there are 5 categories that we review, and with each category, we provide a score, 1 through 5. So those categories include significance, approach, innovation, applicant, and environment. A higher score means a better application in that category. So for instance, the highest score in terms of significance would be 5, lowest score would be 1. So given that there are 5 categories, an individual reviewer can rate an application as a whole from either 5 or 25 total. So 5 being the lowest score you can get and 25 being the highest. And then, as I mentioned earlier, the subcommittee reviewers come together, we add our scores up to create a total score, and that helps us decide who the awardee is for that year. You can move along to the next slide. So I have to say I'm not much for just reading word for word sentences on a presentation, but I think this is important enough to really go through the specific questions that we ask ourselves related to these different categories. So I really would like to do that now. When we look at significance, what does that really mean? So we're asking ourselves, does this project address an important problem facing the bleeding disorders community? If the aims of the application are achieved, will the scientific knowledge of the bleeding disorders be advanced or the quality of life be improved? And will the effects of this study add to the concepts or methods that drive this field? So this is how the rubric looks. We have the different candidates and we'll write our score in. Moving on to approach. Are the conceptual framework, design, methods, and analyses adequately developed, well integrated, and appropriate to the aims of the project? Does the applicant knowledge potential problem areas and consider alternative tactics? With innovation, does the project employ novel concepts, approaches, or methods, and are the aims original and innovative? Does the project challenge existing paradigms or develop new methodologies or tactics? As far as the applicant is concerned, is the applicant appropriately trained and well suited to carry out this work? And is the work proposed appropriate to the experience of the applicant? And I have to say, related to this category as well, we're looking at mentorship and that sort of thing also. For the environment category, does the environment in which the work will be done contribute to the probability of success? This also goes along with mentorship. Does the proposed project take advantage of a supportive environment or employ useful collaborative arrangements? And is there evidence of not only mentorship, but institutional support? So we look at all of these things and you know, also consider the individuals from which you obtain letters of recommendation, you know, and the fact that we review those as well when we're looking at the rubric and scoring. Next slide, please. So some final steps. So final steps are agreement execution between NHF and the fellow and the organization. That's once an awardee is chosen, and that will occur in the fall. And then the start of the award period is January 1st. As I mentioned earlier, there are valuable details online. The YouTube video is linked here, as well as the website on the Nursing Excellence Fellowship. And with that, I believe we can take some questions.
Thank you all. That was really good. We do have a few questions here. And I think I'll just sort of start down the line, if you don't mind. Kelly, so recruitment is always an issue. Did you have any problems with recruitment? And if so, how did you overcome that?
With recruiting patients to my study, you mean?
Yeah.
Yeah. It was pretty easy. Our patients are usually very interested in what we're doing when we come in and talk to them about it. And they're usually really willing to do research within our hemophilia treatment center. We're a really large center and we have a lot of research days, so they get approached often. I was lucky enough to have that support through our local nursing research department, who gave us $10 CLIN cards, which are basically like a gift card for patients, like a little Visa or MasterCard for participation. So it's very easy to get adolescents to do something when you tell them they're going to get some money for it. But overall, you know, it was pretty easy. You know, follow-ups take a little bit of time. Sometimes it's harder to capture them on the back end, but you just got to be persistent and stick with it. You know, keep trying to capture them, and you can meet your goals. It just takes time and persistence. Don't give up.
Okay, so you didn't use your excellence fellowship, the monies that were included with that. You didn't use that towards recruitment gift cards or anything?
I actually didn't. I utilized the budget for different things, such as purchasing like the laptop that we needed, making our database that we needed. That took a lot of time and development with IT support. So the funding kind of went to a lot of other departments, and for time. A lot of people on here, if you use it, you can, you know, buy your time back to have the time to do this project. That's a big piece. A lot of people say, I don't have time to do this, but when you get this funding, you can utilize it towards your time. So, you know, it's definitely an incentive you can think about when you're making your budgets and proposing it. You know, doing a cling card or a gift card to patients for participants might be something you want to add into your budget. I hadn't thought about it on the front end, but my nursing research department, who helped mentor me, came up with it after the fact and offered that support, which was nice.
Okay, I think we hear oftentimes in the physician world that they have protected time for research or something like that. And I think that's what you would possibly call that. If this would pay for your hours, then that then becomes your protected time to do this research.
That's exactly right. Yes.
Mm-hmm. Well, thank you. Lydia, I think you may have addressed this a little bit, but would this webinar be something that could be shared at a national level or at like a national EMS meeting?
It could be. We have, looking at, for the state of Missouri, said that we wanted to, because the EMS providers have local, state, and national meetings that they attend, and so this has been a project that has been considered. I'm working with the STARS people to look at that. It would be, I think the webinar would be of a different fashion than the teaching that we just do in the classroom, but rather the intent of the webinar was for the EMS providers from state to state would be to say what this program was and how, with the basics of that, like how the recruitment of patients occurs and the education for the EMS providers from state to state, because every state does have different guidelines for how they do the education of their providers. So yes, that's a great point and something that we've discussed. Our first and foremost is the webinar for our providers here locally so that we can get more of an impact in our own area. But yes, that's a great idea.
So how would this be something that could be replicated across HTCs, something that could be easily integrated? You know, like our school visits, I don't think we think of EMS visits.
Correct. And with school visits, we're talking to staff who are licensed and work in a fashion much like we do ourselves as nurses, but rather with EMS staff, there were 6 different levels of EMS providers that are possible. And so to reach those, and depending upon what they require for their certification and their licensure, depends upon how you teach them. But all of them have the desire to want to help these people out in the community. Many of them arrive on the scene and in our patient population have been told, well, you just need to give them that medicine. But again, without having a medical director that says that that's okay, they're really not able or possible to do that. I'm not really, that was, other than doing education and maybe a webinar across the states and nationally to say this is a possibility, I'm not sure how the different states will do that, because our STARS program had said they're not sure how different states would implement this, but rather if you gave them the framework for our STARS program, perhaps they would be interested in developing something in their own states similar to this. Because again, the STARS program looks at a lot of different complex medical issues. Hemophilia just happened to fall into that because we had, as I said, a family in the state that was trying to push that it be legislated that people had to do this. And so they were like, hey, can you come out and start teaching some of our people how to do this? And there's certainly been a great interest on the part of the EMS providers that we've worked with regard to this.
Mm-hmm. All right. Well, thank you. Brittany, is there preference given to research over educational projects, one over the other, when the committee is reviewing these projects, the applications?
No. I mean, and I would say the last few years that we've done it, at least, because I can only speak to my involvement, we've had a good mix. So I can't say that there's preference to one over the other. We're really looking at the applications as a whole. And like I had mentioned earlier, looking at that rubric and making sure that it's a well-rounded application and there aren't any big concerns with it. So it's a good question.
And is there any support at encouraging, or is there anything there, I'm trying to remember, for dissemination, to make sure that there's a plan to disseminate this work and encourage them to, submit abstracts or consider doing a manuscript or anything like that?
Yeah, I mean, I think there maybe should probably be more in terms of encouraging developing abstracts and going toward publishing something. I can say that as it stands now, and I should have mentioned this earlier, the awardees have an opportunity to present their project to the other nurses at the NHF Bleeding Disorders Conference every year. And so every year, this year, I can say that we're kind of kicking off the nursing pre-con session with the last project from 2020. Usually when we're in person at the Bleeding Disorders Conference, it's around the time that we do the nurses luncheon. So for future reference, it'd be great to support your fellow nurses and tune in and listen to that. But also that's where kind of our main venue of dissemination is right now.
Okay. Well, that's encouraging to hear too. And just wondering, Kelly, how are you planning when you're finished to disseminate your information?
Well, I got to present at NHF a couple years ago when it was time for my fellowship to come up and review what the project was. And I told everybody at that one I was going to come back when all the data was collected and go over the project and all of the information. So that's one of my goals, is to hopefully get to present at NHF next year once all the data is collected and we've done our analysis. And then I do hope to submit it either for some sort of posters or poster presentation or presentations at some of the other national meetings that are out there for our bleeding disorder community.
Okay, thank you. And Lydia, we just have another minute or so. Do you have any plans that you didn't mention for dissemination?
No, but that makes me, obviously hearing those options is making me, gives me pause for thinking about how to best put that information out other than to present at the NHF meeting. Maybe, I don't know if there's possibilities of putting out information in the NHF website that nurses could link to, or that even anybody else could link to, whether or not that's HemAware or other pieces of options that are available out there. That's a great idea.
And publication. I didn't mention it, but that's definitely, another avenue. We want to put it out for publication. It took a long time to do these projects, so hopefully we can submit the data for even further audiences.
And to your point, Lydia, we do have on the website, Karina has done an amazing job at making sure your pictures, your bios, your project names are out there. And that would be something for us to consider at NHF if there was some way that as this progresses and you have outcomes that we can link to that eventually, that we might be able to include outcomes, you know, like an abstract or something like that. But we wouldn't want to impact your ability to publish. So that would have to be something to consider too. So,
Correct. Just,
well,
and I wanted just to add one other thing. So I know that as people, you know, Kelly made a comment about, you know, submitting an application for this and that process, and I was overwhelmed initially at the thought, but because what I wanted to do was very much of a clinical project versus something that was as much research oriented with different groups, et cetera. So, and then the amount, I mean, I knew that with my project to begin with, I wasn't going to be able to use I wasn't going to need $15,000, but I was so encouraged by the people from the nursing working group to work on a project and submit that, and then that you didn't have to use the whole $15,000 if your project wasn't going to require something like that. You did not have to ask for the entire amount. So
yeah, that's
although
true.
I imagine most people would want to
Yeah.
use more than versus less. So
Yeah, you don't have to take the entire amount, but we do want to encourage good projects and good research.
right.
Is evident from you guys that is out there. So amazing work. Congratulations to all of you for what you have done, what you have accomplished. You're amazing nurses. Happy Nurses Week. Thank you, Brittany, for representing the Nursing Working Group and all of the work that you do through the working group for the national nurses. And with that, we're going to come to an end. Thank you all for everything. And Karina, thank you for the work you've done to put this together. So have a wonderful rest of your week. Bye-bye.